Rheumatoid arthritis and diabetes. What is the link? Rheumatoid arthritis is a type of inflammatory arthritis and autoimmune disorder. People with rheumatoid arthritis have an increased risk of diabetes, while diabetes can also raise the risk of rheumatoid arthritis. Excessive inflammation, lifestyle factors, and genetics may be among the factors that connect the two conditions. Rheumatoid arthritis and diabetes also share several risk factors and causes, including certain medications. This video discusses the link between rheumatoid arthritis and diabetes and explains how people can prevent and treat each of these conditions. The link between rheumatoid arthritis and diabetes. Although diabetes and rheumatoid arthritis share some similarities in terms of their causes and risk factors, they are very different conditions. Rheumatoid arthritis is an inflammatory autoimmune disease in which the body's immune system mistakenly attacks healthy cells and tissue. It often causes inflammation in the joints of the hands, knees, or wrist. In some cases, it may affect the lungs, heart, eyes, or other organs throughout the body. Type 2 diabetes is the most common form of diabetes. In a person living with the condition, the body either does not produce enough insulin or does not use it effectively. In either case, blood sugar levels will elevate. Inflammation and TNF buildup. The most likely connection between type 2 diabetes and rheumatoid arthritis involves inflammation and a buildup of cytokines known as tumor necrosis factor or TNF in the body. The Arthritis Foundation notes that TNF plays a necessary role in wound healing by causing an inflammatory effect. However, it can be harmful when too much TNF is circulating in the body. In rheumatoid arthritis, the immune system's attack on the joints causes TNF to build up in the body. In type 2 diabetes, fat cells mainly produce TNF, which can cause the body to develop insulin resistance over time. As a result, it is possible that the inflammation and TNF associated with rheumatoid arthritis could increase the risk of a person developing type 2 diabetes. Medications and lifestyle. Other possible connections between rheumatoid arthritis and type 2 diabetes involve medications and lifestyle factors that can act as risk factors for both conditions. Certain medications such as corticosteroids can increase the likelihood of developing type 2 diabetes. Also, rheumatoid arthritis might lead to a person having a more sedentary lifestyle, which is a risk factor for type 2 diabetes. Type 1 diabetes. People living with type 1 diabetes may also be at higher risk of developing rheumatoid arthritis and vice versa. The Global Healthy Living Foundation, a non-profit organization, explains that type 1 diabetes is an autoimmune disorder in which the immune system mistakenly attacks insulin-producing cells. It notes that a person living with one autoimmune disorder has an increased chance of developing a second one at some point in their lifetime. Can arthritis cause diabetes? People living with rheumatoid arthritis may have an increased risk of developing type 2 diabetes. Researchers have found that people living with rheumatoid arthritis are 23% more likely to develop type 2 diabetes compared with the general population. In a 2020 review, researchers noted that rheumatoid arthritis can negatively affect a person's insulin resistance, which can cause the body to develop more fat They also reported that many people with rheumatoid arthritis who develop type 2 diabetes also have other risk factors, including obesity. People living with rheumatoid arthritis may be more likely to develop type 1 diabetes, as both conditions are autoimmune disorders. A person who has an autoimmune condition is more likely to develop another one during their lifetime. The Arthritis Foundation suggests that people over the age of 45 years get screenings for diabetes every 3 years. Nothing that this is particularly important for those living with rheumatoid arthritis. Can diabetes cause or worsen rheumatoid arthritis? People living with type 1 diabetes have a higher risk of developing rheumatoid arthritis. In part, this may be due to both conditions being autoimmune disorders. There also may be a genetic link between the two conditions. Research has shown that the gene PTPN22 is linked to both conditions. Some researchers believe that the inflammation associated with type 2 diabetes triggers rheumatoid arthritis in people who are genetically predisposed. A 2014 study in Taiwan supports this theory, finding that living with type 2 diabetes increases the risk of rheumatoid arthritis in females. It is unclear whether type 1 or 2 diabetes could make rheumatoid arthritis symptoms worse. However, similar lifestyle changes can help both conditions, including maintaining a moderate weight, eating a well-balanced diet, exercising regularly, quitting smoking or avoiding second-hand smoke. Treatment. Doctors can help create an effective treatment plan for a person living with rheumatoid arthritis, diabetes, or both. A doctor can recommend a combination of medications alongside self-care strategies to slow the progression of rheumatoid arthritis and prevent joint damage. The CDC says that possible strategies for people living with rheumatoid arthritis include learning safe and effective ways to manage pain, exercise regularly, and make any necessary lifestyle adjustments, maintaining a moderate weight, getting regular safe exercise, seeking regular care from a doctor, and taking all arthritis medications according to the prescriptions, avoiding smoking. The Arthritis Foundation notes that treating a person living with rheumatoid arthritis and type 2 diabetes is not much different than treating a person living with rheumatoid arthritis alone. One of the most important aspects for a person living with both conditions is to get regular exercise to help prevent heart disease. A doctor may recommend a combination of medications and lifestyle adjustments to manage diabetes. In some cases, a person may find that diet and exercise modifications are enough to control their blood sugar. If a person cannot control their blood sugar with diet and exercise alone, a doctor may recommend medication. They may recommend drugs to help the body process sugar or prescribe insulin.